Okay, your SSRIs, or your selective serotonin reuptake inhibitors, they're the most widely prescribed antidepressants. They're as effective as the TCAs, but they have less side effects. And in fact, TCAs have the potential to be cardiotoxic, that arrhythmia that I talked about. So these drugs don't have as much risk with that. The mechanism of action is they selectively block the reuptake of certain types of serotonin in the synaptic cleft. So how they work, why do I have that twice? I have no idea. I must have copied something off in my slide. So they produce a selective blockade of the reuptake of serotonin in the cleft, and it requires a specific transporter to move the serotonin across the membranes, which allows for that specificity. When the reuptake is blocked, the serotonin stays there longer, we get more happy hits, everything is great. So that's how they work. The SSRIs are well absorbed in the GI tract. They do are metabolized using the cytochrome P450 enzymatic system, so that's something to be aware of. Side effects of SSRIs include nausea, anxiety, sleep disorders, sexual dysfunction, and because of that cytochrome P450 enzymatic component, they do have many drug interactions. Other things that can occur as side effects include decreased appetite and nausea, diarrhea, serotonin syndrome, and suicidal ideation. Insomnia is a common side effect of the SSRIs, so because of that, most times these are diagnosed or these are prescribed to be taken earlier in the day, not at bedtime. The warning labels associated with SSRIs may impair the ability to drive. They should not take these medications while drink alcohol while taking these medications. So generally, if someone is suffering from depression, they should not drink alcohol anyways. Alcohol is a system depressant, so they they should avoid alcohol. SSRIs may cause dizziness. If it's a delayed release formulation, they should swallow it whole and not crush or chew the tablet, and they should not discontinue without the supervision of their physician. Also, doses are generally given in an increasing dose. They increase them gradually till they reach the desired effect. And then they need to be taken off them the same way. So they decrease the dose gradually. So the drugs in the SSRI group include citalopram. So like I was saying in class, be careful, this is not a PAM or a LIM, it is a PRAM. So citalopram is Celexa. Escitalopram is Lexapro. So these drugs are chemical isomers. They both contain the drug citalopram, but this one has a different chemical structure. I don't know that structure is the right configuration. That's what I should say. It's a different, it's kind of like having something and twisting it. So it's the S isomer, and it has to do with the imaging of the actual molecular structure. They have the same chemical makeup, but they're just formulated a little different because they have a little twist in them differently. So here are labels. So Celexa comes in tablets and it also comes in an oral solution, and Lexapro comes in tablets. Then we have fluoxetine, which is Prozac or Serafem. Fluvoxamine, Luvox. Paroxetine, which is Paxil. And sertraline, which is Zoloft, which I talked about in the previous chapter. Now, the thing here with Zoloft, we see that there's tablets and there are capsules. When a physician writes a prescription, they have to identify, do they want tablets or capsules? We cannot substitute without approval from the physician. You cannot substitute a tablet for a capsule or a capsule for a tablet. They will have different mechanisms. So it's very important. They are the same strengths. They come 25, 50, and 100, just like over here. So we have to identify, are we dispensing tablets or capsules? All right, more sound alike look-alike. So Celexa can sound like Zyprexa. It can also sound like Celebrex. So that could be a problem. Fluoxetine, which is Prozac, versus fluvoxamine, which is Luvox. And then we have brand names. Luvox can sound like Lavoxil, which is a drug that's used for thyroid. Or Lovenox, which is a low molecular weight heparin. So that's a blood thinner, and it's given by injection. So by paying attention to the dosing, Paxil and Taxol, we brought that up in the last chapter. That's a chemo agent. And Paxil and Plavix, and that's an antiplatelet or a blood thinner. Oops, that shouldn't have a T. That's a platelet. So these are your sound alike look like SSRIs. The next drugs we're going to talk about are monoamine oxidase inhibitors, which have the abbreviation MAOIs. MAO is the chemical, and this drug blocks that chemical that would break down the monoamines. So monoamines include the neurotransmitters norepinephrine, dopamine, and serotonin. So don't get MOA, which is mechanism of action, confused with MAO. All right, so the enzyme monoamine oxidase, or MAO, is found in terminal neurons, also in the liver and the intestine, and there are two forms. There's subtype A and there's subtype B. The monoamine oxidase inhibitors will block the action of the enzyme monoamine oxidase. So when that happens, it stops the breakdown of those monoamines in the synaptic cleft, so it leaves them available for more happy hits. So MAO type A is used in the treatment of major depression and preferentially interferes with the metabolism of norepinephrine